So for my clinical assignment 1 for mental health, for the admitting diagnosis, I have alcohol and substance abuse. Under assessment findings, I have elevated liver enzymes, blood alcohol level of over 300, blood pressure of 150/78, which could be due to alcohol withdrawals. However, his current blood pressure reading is still elevated, so this could point to an underlying blood pressure issue. Decreased albumin levels, these all indicate signs of increased alcohol abuse, as well as patient stating that he has been increasing his alcohol and substance abuse. Patient did say that he does have some balance issues, and he is also exhibiting some signs of depression as his spouse passed away 5 months ago. For client problem 1 description, I have misuse of alcohol and other substances. Elevated liver enzymes point to alcohol abuse, blood alcohol level over 300, as well as subjective data as the patient stating that he did increase both alcohol and substances following the death of his spouse. That is the problem 1 that I found, and some interventions for that may include group therapy, such as a 12-step group like AA or NA, cognitive behavioral therapy, and we also need to provide education on substance abuse as well as some withdrawal symptoms that he might experience. So support the patient's physical and emotional well-being as well. For client problem 2, I have depression due to the loss of his spouse because Boyd stated that he does not want to feel any pain. Since the loss of his spouse 5 months ago, the family has not visited, only friends who he refers to as his party buddies. Some interventions I put for that may include some depression medications such as SSRIs, TCAs, SNRIs, therapy, or a few lifestyle changes. We need to be sure to offer the patient support for physical and emotional well-being because this is a tough time that he's going through, but him only having interactions with people who he refers to as his party buddies, that's not helping his alcohol and substance abuse. For client problem 3, I put hypertension control because and during the initial assessment, his blood pressure was reading 150/78, and during the unfolding, it was still reading 140/70, which is still elevated. So I did put hypertension control. Some interventions, under the interventions, I put patient has been showing signs of high blood pressure due to the initial blood pressure reading and discharge blood pressure reading. We need to report blood pressure reading to the physician/nurse that's overlooking his care at the inpatient rehab facility that we're going to. We can recommend some things for him, such as diet changes, exercise, or hypertension medication, antihypertensive medication. But since he is going to another facility, we are going to report all of that to them. For potential client outcomes, the patient will verbalize the acceptance for treatment. He will admit the inability to control his addictions and accept treatment. The patient will regain and maintain a healthy state with an alcohol and substance-free lifestyle. The patient will cooperate with physical therapy and occupational therapy if needed. The patient will cooperate with therapy as well as taking any depression and antihypertensive meds.